Hey guys, Ryan from Key Health here. Today we're going to talk about tennis elbow, all things tennis elbow, and we're going to focus in particular on a nice taping technique that you can do yourself in order to improve the pains associated with tennis elbow. So what actually is tennis elbow? Tennis elbow is also called lateral epicondylalgia, and basically what it is, it's an issue with the tendon that runs out and connects to your extensor muscles of your forearm. So they basically make your ability to extend your wrist like this. They also are really important in gripping, because as you can see, when I go to grip with my hand, I actually rip back here into extension like so. If you do have an increase in workload, you can actually irritate the tendon, which can actually trigger this tendon problem. Or even if you work in a very repetitive industry, like even sometimes with typing or factory workers, you can actually irritate the tendon. What you'll feel is you'll feel a lot of pain coming through the actual lateral part of your elbow just here, and you'll find that over time it gradually gets worse. If you don't nip it in the bud early, you can actually have your tendon problem get quite severe, in which case you're not actually able to work. So once you do feel that you do have a bit of pain through the forearm, it's important to go seek professional help. In the meantime, you can practice this taping technique I'm going to show you in order to reduce some of the pain that's affecting you. So today guys, all we're going to use is we're going to use a little bit of hyperallergic tape here called Fixable. And basically that's only for if you are allergic to tape. If you're not, you can get away with just using this 38mm brown rigid tape as well. But basically what you want to do is you want to have a look at the crease in your forearm there. You want to make sure that the tape doesn't actually go over that section there. So right next to it there, and then you're going to go across the circumference of the forearm just like so. So you can actually fold it up here so it doesn't stick to itself like that. And the good thing about this is it's actually a really easy form of taping, so you can do it to yourself very easily, unlike some other taping. Come around the forearm, just connect it in like so. So now we use the rigid tape. Basically the technique that we're using, we're going to overlap the tape a little bit in order to provide a little bit extra tension in the actual strapping technique, because we want to provide a little bit of tension actually around this lateral epicondyle just here, so we can actually stop the tendon from being irritated. So basically you just start it off at the back here like so, and then from there, as you finish it there, you're just going to overlap the tape just like so. Then you get another little bit of tape here. You're basically just going to overlap the tape like that. Once you've done that, it doesn't matter if it's a little bit messy, but because you're doing it to yourself, but the main thing is that when you do hook it, you've got that little bit extra tape just on the edge there, and from there you're just going to pull nice and tight around like so. And you want to do that probably twice as you go through. At the end, just to finish it off, you can get a little bit of this stretchy tape just here and just go around it once just to get a little bit more tension as well. So there you have it. It's a little bit more fiddly than getting somebody else to do it, but basically you can strap up your forearm there, then you can go to work and have a little bit of that tension and pain that you have had going through for the last couple of weeks and have that go away. I would suggest though, because this is an overuse injury, it's really important that you get given corrective exercises and manual therapy through massage and manipulation through a health professional. Thanks.